to help vaccinate during the first phase of the state distribution. In addition, we are making a group of our Orange County Health Services nurses available to help participate in the vaccination events, as well as clerical staff to help keep track of who is receiving the vaccine. Since the pandemic began, there have been a total of 66,706 COVID-19 cases in Orange County, so nearly 67,000. I never thought we would reach that number actually here in Orange County. That is an increase of 2,559 cases from our last briefing, which was Monday of this week, with 879 new cases reported just yesterday. Our rolling 14-day positivity rate is now 8.4%. I want to put that number into perspective for you. Exactly 2 weeks ago, the 14-day positivity rate was 6.2%. This is not going in the right direction. 697 Orange County residents have died as a result of the coronavirus. That's an increase of 18 deaths since Monday. 18 too many. I know that there are other metropolitan communities around the country who see far worse scenarios than what we see here. Our hearts go out to the families who have had to deal with the virus and death of their loved ones. It really accentuates the fact that we cannot stop taking the precautions that we are doing here to keep our loved ones safe. We all know that our assisted living facilities have some of our most vulnerable residents. Since day one of the pandemic, Orange County government has made it a top priority to ensure local assisted living facilities have all the personal protective equipment they need to protect their residents and staff. Since the pandemic began, Orange County has delivered critical personal protective equipment to 175 assisted living and long-term care facilities in our county. Approximately 6.4 million PPE items were distributed, including N95 masks, procedural masks, gowns, gloves, and hand sanitizer have been distributed. This week, we endeavored to ensure free testing was available to our residents. Orange County Health Services continued COVID-19 testing at Barnett Park. The demand has been extraordinary, and we'll continue to offer testing each day with the exception of Christmas Eve, Christmas Day, and New Year's Day. We are averaging about 1,600 tests daily at Barnett Park. Health Services performed 1,585 tests yesterday. Of that number, 1,157 were antigen tests, the rapid tests. The test site is scheduled to be open from 9 a.m. to 5 p.m. daily. However, we had to close the line early for the last few days because of the demand. For more information on testing, visit our website at ocfl.net/testing. Now let me talk a little bit about our crisis assistance programs. Our Orange Cares for Residents program, which provides $1,000 grants to those impacted by COVID-19, is now closed. And there will be no more applications with the current round of CARES funding. This is because the federal CARES dollars allocated locally must be spent by December the 30th. We opened the application portal for the final time this morning at 8 a.m. This was the 12th time we opened the portal since June of this year. The application portal reached the 10,000 user capacity in 47 minutes. We closed today at 8:47 a.m. If your application is approved we ask that you please allow up to 30 days for processing and mail delivery of your check. The CARES team expects that all residents who were approved will receive their checks by the end of January at the latest. Some will likely receive checks next week. More than $55 million have been mailed or in the process of being sent to the comptroller's office. $55 million in checks. Thank you to our CARES team on this heavy lift in helping the residents in need. And next I'll talk about the eviction diversion program. We will process existing applications for another week. The program has been a lifeline for many. So far, we have been able to keep nearly 2,400 families in their homes. We have paid out a total of $7.5 million in CARES Act monies to landlords on behalf of their tenants. For those who are on the verge of eviction, we have free legal resources that may help as well. We ask that you go to our website at ocfl.net/resident resources for more information. None of this will likely have been made possible without the direct allocation of $243.2 million in CARES Act funding that we received as a local government. If you have been the recipient or benefactor of any of these dollars as an individual, family, or small business, I ask that you please make sure that you let members of Congress know that you support local funding for any future stimulus rounds. I just believe that at the local level, we're most familiar with our community and our residents, and we must have the flexibility when we allocate the dollars to those in need. Now I'll talk a little bit about our strike teams, our compliance teams. Since the team started back in August, they have visited nearly 6,000 locations and have conducted almost 6,700 inspections. The overall compliance rate remains high at 98%. On December the 8th, my executive order allowed our teams to cite and warn businesses that are out of compliance. The teams have now visited 303 businesses since that time and have issued 26 warnings and 7 citations. Finally, for all of you who donated to the Mayor's Toy Drive, I'm happy to report the toys have been getting in the hands of those who need them the most. Earlier this afternoon, I joined parents and members of my staff at the West Orange Neighborhood Center for Families to distribute toys to children in need. Thanks to the generosity of our community, many children will experience the excitement of opening presents next week. We collected a record-breaking 10,000 toys this year. This would not have been possible without the support of our residents, Orange County firefighters, and our online donation site called Runga. I can't tell you how moving it was to see the toys being selected, knowing how it would make a difference in the life of a child. 2020 has been hard on so many families, but the overwhelming community response to the toy drive has shown why Orange County is such a great place to live. From the bottom of my heart, Thank you, Orange County, for caring about the people who live here. With that, I'm going to turn it over to Dr. Pino.
Thank you, Mayor. Good afternoon, Mayor. Good afternoon, Superintendent Dr. Jenkins. Good afternoon, everyone. So the Mayor have give you the numbers, and the data is continue to point in the wrong direction. Yesterday, that's the data that we're offering today. We had the highest number of cases in the last 14 days for 879 new cases yesterday. That gave us a positivity rate of 9.6%. But 2 days ago, on the 14th, we have our highest positivity rate in the last 14 days, and that was 11.4%. This was expected to a degree, but it's also, as the Mayor announced, the number of deaths has also increased. Although the data so far will not move the rate, but we can start observing an increase on the number of fatalities that are starting to come into the health department. 15 of those fatalities had unknown conditions to us. Have underlying conditions, and 2 have non-unknown conditions for us. 44 of those deaths were from November, but the large majority, the rest 13, were from December, from this month. Our recovery rate has decreased to 90%, and the total number of deaths is rapidly approaching 700. As you know, we have continued to insist that even with the news from the vaccine, we should continue to wear masks, we should continue to wash our distance, wash our hands frequently, and also clean surfaces that often touch. And we also are recommending measures at home. Inside your house, you may have to social distance if you can when you can. Wear a mask when you are too close to individuals that you don't know their status, and protect people who are 65 years or older. The transmissions right now are happening at home. That's the larger number of transmission that we are experiencing. Of the people that we have interviewed, 16% of those so far, right now the data shows, are asymptomatic. That's a significant number of people. And the age has increased, the median age, to 39. The older the pandemic gets, the less asymptomatic we are going to see, as we have experienced in the past, but also the number of deaths will increase as the pandemic gets into the older segment of the population. That's why the urgency to quickly move into vaccinating people in assisted living facilities and nursing homes as the state proceeds with those plans. As the Mayor mentioned to you, we stand ready together with the county to help when asked, and we are making preparations also to provide vaccination to all EMS services providers in our county between the 26th and the 31st, in those days. If we receive the vaccine on the day that is scheduled to arrive for us, Moderna, if it gets through all the approval processes and the recommendation from the CDC, we should be ready for the 26th. We are starting the 26th because we want to do it between the 2 holidays, so that if we start the 24th, we may go through rotations, and a lot of people may be off the day before Christmas and the day before the New Year's. So that's why we are going to try to intensify our vaccination for EMS providers on those days. We will extend if we need as well. Our vaccination is going to take care at the Orange Convention Center. Mayor, thanks for allowing us to use the Convention Center, and thanks to the Convention Center for the collaboration. We are intensively planning, and we will be able to give you more information as we get ready. It is also important to know that although there is a schedule for vaccination based on risk and exposure, potential exposure, so we are going to try to take care of all the 1 classification, 1A, B, and C. And those will be healthcare providers that are being done by the hospitals at this point. They also have a priority list based on the work that individuals do in those facilities. Then the CVS and the Walgreens, and if we need to help, we will help too, will move into the assisted living facilities and nursing homes. At the same time, we should be doing EMS providers, as I talked to you. After that, then we are going to move into law enforcement. And after that, we also will move into other care providers in more general areas. At the same time, we will be vaccinating the health department employees that are part of the campaign, and slowly all our employees that may decide to be vaccinated. That will be the same for those employees of the health services from our county. We have established a number of classes and sessions to train all the EMS providers, as the mayor expressed to you. We are doing 2 classes a day. So what we are doing with this is preparing for when we go into mass vaccination, that we probably will have to use more than one site. At this point, I will pass the microphone to our superintendent of school, Dr. Jenkins. I will answer any questions that you may have after this. Thank you. Superintendent.
Thank you, Dr. Pino, and let me again just publicly thank you for your support and your partnership with Orange County Public Schools, all the work that we are required to do. I also have to publicly thank our mayor for his incredible leadership during this pandemic and this crisis that our community is going through, and for the support being provided to all of our families. OCPS serves over 200,000 students, and so many families are suffering, and so many will be included in those numbers that will have a happier Christmas thanks to the mayor's toy drive. This past week, our highest number to date of cases reported was on Monday, when we reached 90 positive cases. Over 2,000 since schools have been open, which in general, considering 200,000 students, is remarkable. However, we are deeply concerned that those numbers are growing. So Friday is the last day of school. I'm sure anyone who has school-age children is well aware of that fact. Winter break begins next week. When we return, we already know that over 18,000 students will be coming back to face-to-face from doing their digital instruction previously. So another 18,000 will be returning, and actually the number will be greater than 18,000. That's what we've documented. We still have other children that we may need to gather and encourage, if they have been struggling, to come back to face, because we believe we can better serve them there. Thanks again to our parents whose children are doing well in the digital learning, because it helps us manage our numbers and social distancing as those students stay at home for their instructional time. Of those 18,000, we already know an additional 2,000 qualify for busing. So I want to stress, any parents who, although you qualify because you're with beyond 2-mile radius of your school, even if you qualify, we encourage you to consider transporting your children or carpooling, bicycling, any other method of getting your children to school, so that we can keep our numbers low and keep social distancing in place on our school buses. I want to be very clear, when school does open again in January, all of our safety measures will remain in place. That means face masks will still be required, and we will do as much distancing as we can feasibly accommodate in our schools as those increased numbers show up. And we will have sanitation provisions in all of our classrooms, and hand washing provisions as well. Here's the thing. As we go on that 2-week break, we are deeply concerned, as Dr. Pino is, and the mayor and anyone else who sees the numbers. What happened after Thanksgiving in our neighborhoods happened in our schools as well, hence the increased numbers. If we are not careful during a 2-week winter break, we are going to see a reflection of that when children return in January to our schools. And again, 18,000 additional children returning. So we want to encourage everyone in our community, our employees, adults, students, everyone, to practice those 3 W's: wearing your mask, washing your hands, and watching your distancing. as you are in public places. And I cannot stress enough, please, please reconsider any large holiday gatherings during our break. Extremely important that we reiterate as we get ready for the return to school, if you have symptoms, you've been exposed, and certainly if you've had a positive test, we need you to avoid returning to school, both adults and students, until clearance has been achieved. And then I'd also like to mention on our website, we've got information on ocps.net. You can click on Here to Help. That graphic will take you to resources including United Way and Second Harvest Food Bank, as many of our families have needed those resources. Several of our schools on Saturday, again, will be distributing meals that parents and families can depend on while we are out of session. As always, we take the health and safety of our students and our staff very seriously. We would ask that you work with us. Let's all work together so that we can stay safe and healthy. In the meantime, we certainly wish all of you a happy, a joyous, a peaceful, and a safe winter break. Mayor?
All right, thank you, Dr. Jenkins. And just as a reminder, if we have Spanish-speaking media who would like to have responses in Spanish, we have Ms. Yesenia Negron, who will do translation for myself or Dr. Jenkins, and Dr. Pino is bilingual. And we also have Dr. Yolanda Martinez from Orange County Health Services, who's been working with our Orange County staff doing the administration of the testing at Barnett Park and doing some other preparation as well on behalf of the county, who's here. If there are questions about eviction diversion, my Chief of Staff, Roseanne Harrington, is here to help respond to any of those questions. If there are questions specific about the compliance of strike teams, we have Mr. Tim Boldick, who is here as well. And if there are any questions about the crisis assistance, we have staff here as well. So with that, we'll open it up for any questions at this time.
Lauren Seabrook, Channel 9. My question's for Dr. Pino. I would like to know, you were talking about the prioritization of after the EMS, firefighters, then law enforcement, you said other care providers. Can you elaborate a little bit more on what that means? And we're getting lots of calls from the 80-plus generation that don't live in assisted living facilities but are very high risk and would like to know when it's their turn.
So the CDC has provided the state with guidance on how to prioritize these groups, and each state could modify those priorities based on their own needs. So I will not go too much into the future because it also depends on how the volume of vaccine behave, the distribution. If we don't face any challenges and we get the vaccines on the amounts that we are suspected we are going to increase, we could quickly move through those groups. So for the 65-year-olders that live outside congregated housing, in their own housing, they are going to have a priority before we move into the entire population. Those will be the first segment of the larger population to receive the vaccine. Now, the issue with 65 years or older in congregated housing structures like assisted living facilities and nursing home is that it's very small space, transmission can happen very quick, and the consequences can be very, dire. So that's why they are so critically important to vaccinate fast and first. Now, any priority list inherently will have unfairness built into it because someone has to go first and someone has to go later. And we understand those feelings that people who have desire to receive the vaccine want to do it right away. But there is limited quantity. The process has to be organized because it has to be a second dosage given. And we want to get ready. So the idea beyond this is to get ready those who are going to provide your care with first, so that they are ready and able to provide that care for the extended period of time that we are going to face this pandemic.
Hi, this is Kathleen with Florida News Network. This is for Dr. Pino. And I'm just wondering, this week you guys gave out 20,000 vaccines, and that was to the healthcare workers. I'm just wondering if you've seen or heard of any reported cases of adverse reactions.
So those 20,000 vaccines were given by the state to the hospitals. So I have not been informed of any severe reactions. If you are talking about those 20,000, I have not been informed of any severe reactions that we have experienced. But people have watched the news, and individuals that, so first, the vaccine is volunteer, and everyone should make an informed decision. And if you have any pre-existing conditions, if you are taking a large number of medications, if you feel unease, consult your provider about taking the vaccine. The vaccine is a choice. It's not mandated. We would like for as many people as possible to take it, but it's a personal decision that individual have to make. But again, I have not been informed of any adverse reactions in our county. But it's also advised that for people with severe allergies, those people that carry the EpiPen with them, to consult with their physicians before they engage.
One for Mayor Demings and one for Dr. Jenkins. For Mayor Demings, just with New Year's Eve around the corner and after seeing what we saw for Halloween, are you going to have any restrictions for New Year's Eve as far as the social gatherings and the bars and everything downtown? And for Dr. Jenkins, of those 18,000 students returning, is a majority of those the high school athletes that were kind of quote-unquote self-bubbling during their football season? And do you have any exact numbers for that?
Okay, in terms of any restrictions, in terms of the size of crowds in downtown, we're going to continue, our executive orders remain in effect through that period of time. There will not be any special dispositions given to any of the bars or others that will be having events. Our compliance teams will continue to go and provide advice to anyone planning gatherings. So we just hope that everyone complies with the executive orders that we have in place. So I'll turn it over to Dr. Jenkins to respond to the second half.
Certainly. So it's probably too early to try to give an indication of where the majority of the students are coming from. I will tell you they are elementary, middle, and high school. Even if we were considering those high school students, that would only bring back probably 400 to 500, because those were the football players, portions of the football teams that were in the bubble. So I would not suspect that there are large numbers of athletes that impact that number. I think it's widespread, elementary, middle, and high school. And it's based on what families need. Either the child needs the additional educational or psychological and emotional support of being in the classroom, or the parents have something that's changed that makes it necessary that they bring the children back. Whatever the case, we are happy to have them.
Hi, this is a question for Dr. Pino, Deanna, Channel 9. I know we're kind of, as far as average daily cases, pretty close or right around where we were at the peak during the summer. Can you tell us what differences you all have noted between about the outcomes or hospitalization of the positive patients now versus in the summer?
So hospitalization continue to be low, although the numbers continue to increase slowly, but they continue to be low. And as the age increase, those hospitalizations are going to increase. Remember, at some point during the summer high that we had, the average age in a day was 21, 22, 23. Right now, we are in the 39, 40, where we were when we have the first big wave. And that's the one that concerns us when the age goes higher.
Amanda Dukes with Channel 2, and this is for Dr. Pino. Dr. Pino, when you say that you are seeing much of the transmission now occur within the home, and you're going as far as advising people to consider wearing masks or social distancing at home, that feels a little discouraging because it seems very unrealistic that people living under the same roof, especially during Christmas, are going to wear masks and social distance. So can you unpack that a little more? How is the transmission happening in homes, and what realistically can families do?
So part of the investigation, for example, let's say, for example, the increased number of students or children in school age. So what we have seen the largest increase right now is 15 to 14, 35 and over. Those are the two segments that we are seeing increases, significant increases. So those are the age of children are the parents. So that's one hint. That is the age of children and about the parents. And the other is that through our investigation, and especially with the school-age children that we are interviewing and their parents, we have come to realize that the transmission is not happening at the schools. And you get that by how many of the people who you place in quarantine convert, and how many people have convert during holidays or during periods at home. So that's how we establish it. Now, the thing about home right now, although we are not expecting, and some people don't have the conditions at the home, so let's be clear about that, to social distance. There are places, people with socioeconomic difficulties right now who may live in a very small place. So that's there. What we are saying is, when you can, wash your hands at home often. Don't think that home is safe in that sense. It could also, home is a place where people come from the school. Mom comes from, let's say she worked at Disney, and that works at a construction company. So you have people from three different directions converging at home. That's now the issue. That is widespread in the community, and then people come right back home from different directions, and then stay home for 8, 9, 10 hours together. So we have seen a lot of transmission in couples that split together. So there's a lot of indications of this happening at home based on the trace investigation that we have conducted. And although we are not expecting people to be masked during dinner, and we are not expecting people to be absolutely masked when they are by themselves, but if you are having a close niche, if you are inviting your cousins and other family members that are not from that household, it would be safe to keep some distance. We can still share food, we can still share time, we can still watch TV together and be separated if you don't know the person's status.
Kelsey Thord with West 2 News as well. This is also for Dr. Pino. Can you just clarify how many doses of the vaccine you guys have gotten so far? And then how many you're expecting if Moderna does get FDA emergency approval?
So the Department of Health in Orange County, that's a distinction. The Department of Florida Department of Health in Orange County, this far has not received any vaccines. The vaccines that are right to our county are with the health systems. That means they were sent to Advent Health, and from there, many had got distributed to other hospitals in the area. I do not know the particulars of how many in what direction to what hospital. We, at some point, will start getting that data, and we will inform you with that data as the data gets processed and the systems in place. Now, we are scheduled to receive about 16,000 vaccines between the 22nd and the 24th. Those vaccines will be Moderna if Moderna goes through the entire process, when it goes through the process. We are anticipating that date if the vaccine gets approved this week, if it goes through the entire process. Because not only approved by the FDA, also have to be recommended by the CDC with specific guidelines on how to use the vaccine. So those are the steps that we're with.
And those would be the doses that you would use for the EMS workers?
Yes, that would be it.
Steve Hudak from the Orlando Sentinel. This could be for the mayor, for Dr. Pino, or for Danny Banks, the public safety director. Dr. Pino, you had just said that there is some unfairness built into any system that we would end up doing. Somebody has to go first, somebody has to wait. What kind of outreach have you planned to reach some of the more difficult communities, the communities that have shown a disproportionate effect from the disease? How are we going to reach out to them? How are we going to make sure that they know they can get it? How do we convince them to I mean, this is a lot of questions, I know, but how do we get them to overcome their fear, if there is fear?
Okay, so we are expecting some funds to come through what the government is about to approve for the vaccine that may include campaign, promotional campaigns. But I think we are going to be pleasantly surprised that response to the vaccine is going to be higher than the noises that we are hearing through the media. The pandemic had such a devastating effect that I think people are very ready to get vaccinated. Now, that is not to ignore that lately has been an increase in the few last year of the anti-vaxxers movement. And again, as I said before, that's a personal decision for each individual. The vaccine is not mandated. But of course, we will reach out to our communities, especially community of colors that had a history of not trusting for the right reasons, I should add, many of our systems that are in place. And part of the strategy would be for the leadership to take the vaccine in public. It would be to use influencers in those communities to be a radio host, to outreach churches and to priests, and to also open our channels of communication to express to people what is the vaccine, what it's all about. But I think actually the fact that healthcare workers who know the body, who know immunology, who know reactions, who know everything that needs to be known, are taking the vaccine at such a good rates, is going to set an example for the population at large. And I think they are going to say, okay, if my doctor is taking the vaccine, then it's safer for me to take the vaccine as well.
I guess, Steve, the only thing I would add is that we have been deliberate in reaching out to certain advocates within our communities of color to work with us and participate in the campaign to ensure that we communicate effectively with those communities and encourage them to participate in getting vaccinated. I certainly agree with Dr. Pino. There's just historic distrust centered around this, but I believe that individuals will be better off if they get vaccinated as opposed to not getting vaccinated. And there will be certainly some circumstances where some individuals, with the advice of their physicians, may not get vaccinated for health-related reasons. But we're optimistic about it, and so we will start a campaign soon in that regard, much like we did with the Safer, Stronger Together campaign in this community. At some point, I know that I will likely get vaccinated, and I'll probably do it publicly, even though, I don't relish in getting a shot, but at some point, maybe Dr. Pino will give me my vaccination. I don't know. I wish I could give him his as well, but in either case, we're preparing, so we look forward to it. We have to get up to, Doc, 79% of our population effectively, and that's a pretty heavy lift for a county with 1.4 million people in it. So it's going to take some time to get to that point. All right.
Stephanie Buffmonte with Fox 35. This is for Dr. Jenkins. So I believe you said an additional 18,000 students will be returning to face-to-face learning. How many total will be in face-to-face come January? And then just one more time, what advice would you give parents who might be seeing extended family over the break?
So 18,000 brings us just under 50%. So we're right around the 100,000 mark for those that are in face-to-face learning. And as I said, we will accommodate those who need to come back and be with us in schools. I honestly will continue the same mantra that the mayor and Dr. Pino have put out there. We really need families to consider having very small immediate family gatherings for the holidays. If there is a larger gathering, there have to be some precautions put in place, because our dread is that when we bring those 18,000 students, additional students back, that we will see enormous increases based on activity that took place during the winter break. And so I would encourage parents, we actually have asked parents, please, if at all possible, contain those holiday gatherings to very small numbers, and hopefully the immediate family. Now, I've shared Dr. Pino's quote over and over again. He said, how about you have a small gathering this year so that you can live, you and your family members can live to see next Christmas. And hopefully by that time we can have much larger gatherings. If families have no other choice, then certainly outside gatherings are preferred to indoors gatherings, hand washing, face mask, distancing, whatever they can put in place. But I just think it's a year to make a sacrifice and not have a large gathering, and to be very careful when you go out in the community and practice the 3 W's that I mentioned earlier: washing your hands, watching your distance, and wearing those face masks. It's critical.
I have a couple questions in Spanish, one for Dr. Pino, who needs no translation, and one for the mayor. Primero con el doctor. Doctor, si pudiera volver a repetir esa porción, la acaba de recomendar la FDA, la vacuna de Moderna, repetir ese mensaje que nos dijo sobre las dosis que vienen y los días que llegan y para quién son. Y en segundo lugar, si ya tienen un plan establecido para la gran mayoría de la población que no estamos en el grupo de los trabajadores médicos, algún plan que ya tengan ya esquematizado. Y para el... después la de la...
So for the English speakers, what you ask is for me to repeat some of the information that I already said in English, so I'm not going to retranslate. Mira, lo que sucede es lo siguiente. El Departamento de Salud en el condado va a recibir 16,000 vacunas que están destinadas principalmente para los servicios de emergencia, los servicios de seguridad como la policía y también para los trabajadores del Departamento de Salud. Yo estaba diciendo que cualquier lista que uno hace, cuando tú pones a alguien primero y a alguien último, siempre hay, no es totalmente justo. Y la gente va a pensar eso. Y el asunto está en que no tenemos el suficiente volumen de vacunas para vacunar a todo el mundo al mismo tiempo con la misma rapidez. Y entonces el Centro de Control de Enfermedades ha creado una lista de prioridades basado en el tipo de riesgo que la persona asume cuando adquieren la infección. Y entonces, por ejemplo, los ancianos que viven en los centros de envejecientes, es importante por el número alto de muertes que hay en esos lugares. Los IMS, ¿por qué es tan importante? Porque son las personas que nos van a cuidar al mismo tiempo que los trabajadores de salud. Entonces, por crear ese tipo de inmunidad, estamos protegiendo a los que nos van a proteger. Por supuesto que tenemos planes para la población en general. Siempre los hemos tenido, y parte de lo que estamos haciendo y vamos a hacer con la planificación para los servicios de emergencia también servirá para la población en general. Y nosotros esperamos que debemos estar posiblemente, si los canales de distribución se mantienen, tal vez para finales de febrero o al principio de marzo, expandirlo a toda la población. Y quizás antes, si los volúmenes de la vacuna continúan llegando.
Mayor, last time I checked the businesses that were either cited or got a warning, I've seen a disproportion between like nightclubs and bars compared to like tire shops and restaurants. But we have seen the crowds in those bars and nightclubs, and what is being done about that?
We have received various complaints from the public.
La última vez que confirmé de los pequeños negocios, repeat the second part of the question. Repita la segunda parte de la pregunta, por favor.
Proporción.
There's a disproportion
Entre los negocios que han sido citados o advertidos. O sea, hay muchos bares que no han sido advertidos, pero hay tiendas, por ejemplo, de cauchos o de llantas que sí. Entonces, parece como que no hay una coherencia
there's a disproportion between the small businesses that have been receiving the orders from the strike team. For example, the bars, they're being penalized, but then other businesses are not necessarily going through the same process.
Okay. And so with the complaints that we have received from the community that's been assigned to our compliance teams, they will continue to take those complaints and respond accordingly. So if we have information about a bar or other location that's in violation, we will continue to visit and inspect those businesses and take appropriate action.
Entonces, las quejas que hemos estado recibiendo de parte de la comunidad, nuestro equipo de cumplimiento va a continuar investigando esas quejas y asegurar de que estos negocios estén en cumplimiento con la ley ejecutiva.
So who we target is directly related to the actual complaints that we receive.
So, las personas que nosotros target específicamente están relacionados a esas quejas que estamos recibiendo de la comunidad.
Okay, thank you.
This next question was texted in from Adriana Rosal from Univision. This is for Dr. Pino, and she would like an answer in Spanish and English. Her question reads, how many people have received the vaccine in Orange County? And if there are going to be any websites or reports to see how many vaccines have been applied and how many people have refused to receive them in the hospitals, what that tracking system might look like.
That's a loaded question. So in English and in Spanish, how many people have received the vaccine in Orange County? I don't know. I haven't seen the data yet. Will we have access to a system that will display the number of vaccinations? And so internally, our department is engaged in and has developed a dashboard that will track all the individuals that are getting vaccinated, what percentage, and where those vaccinations are happening. Now, with any health data, they are always concerned about HIPAA violations, so you have to wait until the numbers are such a size that individuals cannot be identified when you publish that data. So the right to refuse to vaccinate, although may create issues in relationships and at work, is the right of individual, and we should not be releasing data that may identify individuals. I'm going to try to say all that in Spanish. So, la primera parte de la pregunta, si sabemos cuánta gente se ha vacunado hasta estos momentos, no he visto los datos todavía. Y si vamos a tener alguna manera de mostrar la base de datos, el departamento internamente tiene esos sistemas elaborados, pero también la base de datos tiene que llegar a determinado momento donde a través de los números las personas no puedan ser identificadas. Entonces, eso tiene que ser revisado por el Estado. Pero también me imagino que como se hizo con la base de datos acerca de las pruebas, también se haga para las vacunas. Pero yo no he recibido instrucciones al respecto. And Mayor, if you allow me, I will take this opportunity to thank the workers and employees of the health department who has rescinded the vacations and holiday plans for the holiday season to provide the services that we are going to need for those days. So my hat goes to every single employee of the health department and across the county that are taking these extreme measures to be able to provide the services that our community need.
Lastly, from Ryan Lynch from the Orlando Business Journal, this is for Dr. Pino as well. Dr. Pino, how will the county, and Mayor Demings might be able to chime in here too, how will the county prioritize having multiple vaccines for use? Will the vaccine given depend on the supply available of each at any moment?
So if I understand the question correctly, he is asking the differentiation between the Pfizer, Moderna, or any other vaccine that may come, and who is going to receive it?
And how the county will prioritize its use? I guess, is there a difference between the two, or is it first come, first serve?
So in our case, for example, if we receive Moderna, we will continue to receive Moderna. People are supposed to take the second dosage of the same vaccine that they took first. So it's safe to assume that we will have a second round for EMS providers that is going to have the Moderna vaccine in the same amount that we got it in the first. And by the way, it just got approved by the FDA. I just got the news. So with that, that would be the case. Moderna, the two vaccines are very similar. They use the same approach, they use the same technique to achieve immunity. They just use different components of the virus. But the thing for Moderna that is feasible for us is that because we will try to do pods, those are mobile structures that are around the county, and the temperature, the cold chain, the temperature control is better and easier to maintain than with the Pfizer vaccine, taking it around where you have to control the temperature of, minus hundreds of degrees in some cases, depending if you are comparing a Celsius to Fahrenheit. But the Moderna is 25 degrees, so that's normal freezer, and we have ample capacity. Although our county has acquired enough capacity if the Pfizer vaccines were to come to the county for any of those circumstances.
Okay, I think Dr. Pino adequately covered the response to the last question. I do want to recognize this young man from the American Sign Language group, Abdel, who did a yeoman's job, I think, translating the Spanish. So this is his first day with us, and so I wanted to recognize him. And we always have American Sign Language translators with us. They all do a fantastic job, so really, on behalf of our community, thank you all for helping us ensure that we communicate. We come towards the end of another week at this point, and while things are not perfect for us, we have continued to manage and control the spread of the virus in our community, albeit the numbers are edging up slightly. Our goal is to contain it to the extent that we can. We cannot do that without the help, the assistance, the cooperation of everyone in our community, from the individuals to the businesses. So again, we are approaching some critical times as we are about a week away now from one of the major holidays that we all celebrate each year. So we are just asking our community to stay with us, to double down at this time, to make some tough decisions so that we can all get through this in a better shape than perhaps we would if we didn't socially distance and limit the size of the gatherings going forward. So thank you all for being here today. We hope you have a safe weekend.